Welcome to 10-Minute Health Tech, the AI-powered podcast, where we dive into healthcare technologies and companies so you don't have to. I'm Anthony.
And I'm Julia.
Today, we're taking a deep dive into Linus Health,
a company focusing on a challenge that's becoming increasingly urgent.
Okay.
Early detection and intervention for Alzheimer's and other dementias.
Yeah, that's certainly a growing problem.
It's a critical area, and the urgency is only growing.
For sure.
Consider this. Alzheimer's pathology can be present for 15 to 20 years before noticeable symptoms even appear.
Wow. That's a frightening thought. All that time, the disease is silently progressing, and we're often caught off guard when those symptoms finally surface.
Precisely. And this isn't just an individual concern.
Right.
The World Health Organization projects dementia cases to nearly triple globally by 2050, reaching a staggering 139 million.
Wow. Those numbers are truly alarming. It feels like a ticking time bomb. So how does Linus Health aim to tackle this impending crisis?
They've developed what they call a next-generation digital cognitive assessment platform. Imagine taking well-established cognitive tests, the kind neurologists have used for decades,
Right.
and supercharging them with artificial intelligence.
Okay, so instead of just giving someone a pen and paper test, we're talking about bringing in the power of AI to analyze the results. But how does that actually work?
Linus Health's platform digs deeper into the nuances of those tests. It goes beyond simply noting right or wrong answers.
Give me an example.
For example, it can analyze things like subtle hesitations in speech or minute variations in eye movement during a digital test.
Interesting.
These tiny details can reveal a lot about cognitive function, even before more obvious symptoms emerge.
That's fascinating. It's like AI is giving us a microscopic view of what's happening in the brain, but this must be based on some serious science, right?
Absolutely. Linus Health isn't just throwing AI at a problem and hoping for the best.
Sure.
They're built on over a decade of rigorous research and development at MIT and Lahey Medical Center. Their approach combines proven scientific methodologies with sophisticated technology. And it's been validated in over 20 articles published in top-tier scientific journals.
So it's not just a flashy new tech kit. There's real scientific weight behind it. It seems like they're aiming for that sweet spot where cutting-edge technology meets established science.
Exactly. And this approach holds immense potential.
Yeah, I can see that.
Think about the impact early detection has had on diseases like cancer and cardiovascular disease.
Sure.
Early intervention is key. If we can identify cognitive decline in its earliest stages,
Right.
it gives us a much better chance of slowing its progression and improving quality of life for those affected.
It's almost like shifting our mindset from reactive care to proactive brain health management. But how is Linus Health actually applying this technology in real-world settings?
They're doing some very interesting work.
Like what?
For example, they're collaborating with the Davos Alzheimer's Collaborative
Yeah.
to bring cognitive screening into primary care settings. Imagine your primary care physician being able to administer these digital cognitive assessments during your regular checkups. It could revolutionize how we approach brain health.
That's an interesting approach, but could it potentially create bottlenecks in primary care? Physicians are already stretched thin. How would they find the time to administer and interpret these assessments?
That's a valid concern. It highlights the need for a streamlined and efficient system.
Right.
However, consider the alternative, waiting until dementia symptoms become severe enough to warrant a specialist referral. By then, valuable time for intervention may have been lost.
That's a good point. It seems like there's a trade-off between early detection and potential strain on primary care resources.
Exactly. And Linus Health is actively working to address those challenges.
Okay.
For instance, their platform is designed to be user-friendly and intuitive for both patients and physicians.
So we've talked about the science, the technology, and the potential impact of early detection. But what about the human side of this equation? How is Linus Health supporting those who are already facing dementia and their families?
They recognize that dementia impacts the entire family, and they're taking a holistic approach.
Okay.
They're working on programs to support citizens and their families who are dealing with early dementia diagnoses.
I think that's crucial. Dementia isn't just a medical diagnosis. It's a life-altering event for individuals and their loved ones. Having access to information support networks and resources can make a world of difference.
Absolutely. They're also working to empower healthcare providers to detect cognitive concerns sooner. Their platform can act as a tool to help physicians identify subtle cognitive changes that might otherwise be missed.
That's an important aspect. We often hear about the need to increase awareness of dementia, but what about equipping healthcare professionals with the tools they need to spot those early signs?
You're exactly right. Linus Health's platform aims to do just that, empower providers with more time for intervention by detecting cognitive concerns sooner. This could be a game changer in how we manage dementia care.
So we've covered a lot of ground here. We've explored the science behind Linus Health's approach, the potential benefits of early dementia detection, and the ways they're working to implement their technology in real-world settings.
And we've only just scratched the surface.
Oh, really?
There's so much more to uncover about Linus Health's work, including their strategic partnerships and the challenges they face in bringing this technology to a wider audience.
This has been an incredibly insightful look into Linus Health so far. We'll delve deeper into those aspects when we return for part 2 of our deep dive.
Linus Health's real-world impact hinges on its collaborative partnerships.
Oh, that makes sense.
They've teamed up with a diverse range of organizations, healthcare providers, research institutions, even government agencies.
That's smart. It seems like they're building a network to tackle dementia from multiple angles. Tell me more about some of these key partnerships.
One particularly noteworthy collaboration is with Indiana University School of Medicine.
Interesting.
They're working with Dr. Deanna Willis, a leading advocate for integrating cognitive screening into primary care.
That aligns perfectly with what we were discussing earlier. Imagine if these assessments became as routine as checking your blood pressure during a regular checkup.
Exactly. Early detection becomes far more feasible when integrated into existing healthcare workflows.
Right.
But Linus Health's reach extends beyond the U.S.
Oh, really?
They're also collaborating with Health Innovation Manchester in the U.K.
What's their focus across the pond? Are they tackling similar challenges?
They're working with Dr. Tracy Vell
Okay.
to address the growing dementia concerns among citizens and their families. They're using Linus Health's technology to identify individuals who might be at risk and provide them with necessary support, a truly proactive approach.
This proactive approach is so critical. Instead of waiting for symptoms to become severe, they're intervening early to potentially slow down the disease's progression and provide support right from the start. It's a more humane and, frankly, more effective approach to dementia care.
I couldn't agree more. Early intervention can make a world of difference in terms of quality of life and managing the disease's trajectory. And this proactive approach is further exemplified in their partnership with UMass Chan Medical School.
Tell me more about that collaboration. What makes it stand out?
They're working with Dr. David McManus, who's particularly focused on empowering healthcare providers to intervene earlier. They're leveraging Linus Health's platform to pinpoint subtle cognitive changes that traditional methods might miss. Think of it as providing healthcare professionals with a finely tuned instrument to detect early signs of cognitive decline.
It's like giving those on the front lines of healthcare a powerful new tool in the fight against dementia. So it's clear that Linus Health is strategically targeting different aspects of the dementia challenge with these partnerships, from early detection in primary care to supporting families and empowering healthcare providers. It's an impressive multi-pronged approach.
That's a great observation. They're not just relying on their technology.
Right.
They're actively weaving it into the fabric of existing healthcare systems and communities.
Yeah, for sure.
But of course, no endeavor is without its challenges.
You're right. What are some of the hurdles Linus Health faces as they work to bring their technology to a wider audience?
One significant challenge is simply raising awareness and educating the public about brain health. Many people still don't understand dementia or grasp the importance of early detection.
Yeah, I can see that.
We need to normalize conversations about brain health, just as we've done with mental health in recent years.
It's about breaking down the stigma surrounding cognitive decline and empowering individuals to be proactive about their brain health. Knowledge is power, and in this case, it could be life-changing.
Precisely. Another hurdle is ensuring equitable access to their technology.
Okay.
Disparities in healthcare access persist, and Linus Health is actively working to ensure their platform reaches underserved communities. It's not enough to develop a groundbreaking solution. It needs to be available to everyone who needs it, regardless of their background or socioeconomic status.
That's a crucial point. Technological advancements in healthcare should benefit everyone, not just a select few. It's about bridging those gaps and ensuring that innovative solutions like Linus Health's platform are accessible to all. Are there any other challenges they face?
Well, there's the ongoing challenge of scientific advancement. We've made great strides in understanding dementia, but there's still so much we don't know.
Yeah.
Continued research is essential to develop even more effective treatments and interventions.
So it's a two-pronged approach. implementing existing technology while simultaneously pushing the boundaries of scientific understanding.
Exactly. And Linus Health recognizes this. They're committed to staying at the forefront of both technological innovation and scientific discovery. Their work extends beyond direct patient care.
Oh, that's interesting. Tell me more about that.
Linus Health's platform also supports life science research and clinical trials. They're actively contributing to the broader scientific community's efforts to understand and combat dementia.
So they're playing a role in both the present and the future of dementia care.
That's a great way to put it. They're actively working to improve the lives of individuals facing dementia today, while simultaneously contributing to the research that will shape the future of dementia care.
It sounds like Linus Health is truly committed to making a difference on multiple fronts.
They are, and their work is incredibly inspiring. They're a company to watch, for sure.
It's clear that Linus Health is making waves in the fight against dementia, but I'm curious about what's next for them? Where do they go from here?
That's a great question. I think we can expect to see them expanding their partnerships, reaching even more patients and healthcare providers. Their model seems to be about creating a ripple effect, starting with targeted collaborations and then expanding outward.
So more of that ripple effect, reaching further and further. And what about the technology itself? Are they likely to continue refining their platform?
Absolutely. The field of AI is constantly evolving. They're likely to incorporate the latest advancements in machine learning to improve the accuracy and effectiveness of their assessments. It's an ongoing process of refinement and improvement.
It's like they're constantly leveling up, making their tools even sharper. But beyond the technology and partnerships, do you see them taking on a broader role in shaping the conversation around brain health?
I wouldn't be surprised to see them playing a larger role in shaping public policy around brain health.
Oh, really? How so?
They have a unique perspective and a wealth of data that could be invaluable in informing those discussions.
Advocating for more resources and support for dementia research and care.
Exactly. They could become a powerful voice in advocating for change and driving progress in the fight against dementia.
It sounds like Linus Health is poised to be a major player in the fight against dementia for years to come. It's exciting to see the impact they're already having and to think about the possibilities that lie ahead.
I agree. They're a company to watch, for sure.
Thanks for spending 10 minutes with us, and be sure to look for more 10-Minute Health Tech podcasts.
Bye.